Hi there, my name is Dr. Antonia Chiesa. I'm an associate professor of pediatrics at the School of Medicine, and I'm director of healthcare services at the Chem Center. And I'm here to talk to you about one of the programs that we help administer around the state, the Child Abuse Response and Evaluation, or CARE Network, that was established in 2019. It is a state-funded healthcare network created to provide standardized response to suspected child maltreatment. So our goal is to recruit both medical and behavioral health providers around the state to standardize medical care and behavioral health screenings. This is a project that's funded through the Department of Public Health and Environment. We recruit and then train what we call designated providers around the state to administer these assessments. And this program is specifically for children under 6 with concerns for physical abuse or neglect, and under 13 with concerns of sexual abuse. Our administrative hub here at the Chem Center helps support and mentor providers, and then also provides ongoing education. We have an advisory committee to help make sure that we are meeting the goals of our program. And one of the most important pieces is that the funding for this program through the state allows for direct reimbursement to the medical provider or the behavioral health provider that is separate from insurance billing. We are providing reimbursement for typically non-reimbursable activities, such as training or the additional time that these cases sometimes take. To join the network, if you are a medical provider with a specialty in pediatrics, family medicine, internal medicine, and emergency medicine, you are welcome and eligible to join. This includes a wide variety of practitioner types, including physicians, physician assistants, nurse practitioners, and forensic nurse examiners, or SANEs, which sets us apart compared to other networks around the state. Our behavioral health providers are required to be trained in evidence-based and trauma treatment modalities, as well as pediatrics. And you can see here that we allow a wide variety of provider types, including psychologists or master's level behavioral health clinicians. Our goal is really to create a network around the state, some peer community for people who are doing this work, to get to know each other around the state, to share best practices, and really fill that gap of care around the rural portions of the state. So we've developed practice standards, and our providers are trained on these. And then we review case level data to ensure that all providers are adhering to these practice standards. Our behavioral health standards for medical providers are specific, and we follow what's called the care process model for children over 6, whereas our behavioral health providers are allowed to use a variety of different modalities in their assessment of children. And then we really emphasize the importance of recognizing behavioral health concerns and then referring out for the appropriate long-term care. We keep in contact with our providers through a website that's specific to our program, and I highly encourage you to go to carenetwork.org to learn more about our program. And we also do a monthly newsletter, which keeps participants up to date about what's going on, but also shares helpful education. Our providers are trained at an annual conference. New providers are trained over 2 days, and ongoing or providers from the following year just meet for 1 day. And we do education topics, do basic training, and then more importantly, we really network and get to know each other. Here's a picture from our first in-person training after the COVID pandemic in Vail, Colorado. Besides our annual training, we meet monthly over virtual ongoing educational sessions called ECHO. Some people may already be familiar with that modality, where we meet for about an hour, usually over lunchtime, where we have a 15-minute didactic followed by a 5-minute case presentation. And you can see here a list of some of the topics that were part of our didactic training over last year. Most of the children seen in our program right now are seen for medical evaluations, but we are hoping to expand all referrals to both medical and behavioral health providers. The average age of children seen is 5, and about 50% of our cases right now are for sexual abuse. And one of the things that we like to really highlight is that the majority of the cases, providers are screening behavioral health and recognizing pretty significant concerns in those children that warrant additional referrals. And then for our medical cases, about a third of the time, the provider is identifying something else besides the referring issue. So another medical condition or another form of child maltreatment as part of that case. Again, head to our website and check out our annual report if you want more details on our case level data. We are working really hard to evaluate how we do this work. And so throughout the year, we evaluate both our training, but it also our best practice standards. And we're working really hard to make sure that we live up to the statutory requirements of our program. I thank you very much for your time, and I look forward to answering any questions that you might have once you learn more about our program.